A parliamentary report looking into the UK's handling of the COVID-19 outbreak is out, and the findings are not favourable to Prime Minister Boris Johnson, with the landmark inquiry calling the government's handling of COVID one of the worst public health failures in the country's history. Let's go through some of the findings as highlighted by the report. According to the 151-page report, both ministers and scientists took a fatalistic approach. The slow approach meant that the UK fared much worse than other countries. One of the biggest mistakes made by the government was not implementing the first lockdown sooner. The delay led to a higher death toll in the initial days of the pandemic. Though Britain was one of the first countries in the world to develop a COVID test, its test and trace system was slow and chaotic in the beginning. The report also found that there was a failure by the public bodies to share data, not only with the public, but also between local and national governments. It also reported that there was an unacceptably high death toll among ethnic minority groups and disabled people. But the report also highlighted some of the things the UK did right, like the rapid development, approval and delivery of its vaccination programme and the world-leading recovery trial that identified life-saving treatments. The findings are detailed in the long-awaited report from the Health and Social Care Committee and the Science and Technology Committee, which contain MPs from all parties. Tory MPs Jeremy Hunt and Greg Clark, who chair the committees, said that the nature of the pandemic meant it was impossible to get everything right, and that Britain combined some big achievements with some big mistakes, and that it was vital to learn from both. For more on this, WION's London Bureau Chief Mandy Clark is joining us live from London. Mandy, what has the reaction been to this report?
I think there's a feeling of inevitability. There was no doubt in most of the public's mind that there was system failures at the very starting. Britain had the highest death toll among Europe, and there had to be reasons for it. 150,000 people have died in the UK because of COVID. That's at a much higher per capita than all other European countries. What is interesting is Boris Johnson first claimed that he was going for what was known as herd immunity, so allowing the virus to flow in the population to reach a level of immunity. Then he claimed to have not pursued that tract at the beginning. This report really does lay bare that that was the plan at the starting. The question is why scientists didn't fight back more on the MP's initiative, and if they felt like they had a voice. That is a conversation that MPs are pursuing, just to make sure that scientists feel that they are listened to and independent when giving advice. However, as you highlighted, there were those big wins too, of course, being the vaccine rollout.
And just how powerful or influential are these parliamentary committees?
Well, certainly it's a starting point. What really needs to happen is when it comes to the suggestions and those kind of lessons learned, that they are taken forward. And I think the independence of scientists, advisors to politicians will be one of those key takeaways, whether they can be more strongly listened to, because of course the UK line, if you remember way back when, is that they are being led by the science, and that is how they're going to make all their decisions. But it's unclear if there was influence put on the scientists to follow the way the politicians had seen. So independence of scientists will be a key takeaway. Now the question is, will there be really tangible steps moving forward to see that happen?
Thank you, Mandy Clark, for your insights there.